Hi, Lauren Lee.
Good morning.
Morning. We're gonna get started about 5 after again, like usual. So just a couple
Perfect.
more minutes.
Let me grab my coffee real quick then.
geez. All right, looks like it's just gonna be you and I this morning. Maybe some will join us later on down the line, but let's get started. So today we're going to be on page 755. We're gonna be doing chapter 20, massage in medicine. This chapter is quite important because in the state of Florida, you have the ability to work in medical facilities. So you need to understand how to operate within those facilities. And obviously when you choose this path for your massage career, you will tailor your continuing education to mimic that. But this will give you a good entry level understanding of how some of the more holistic methods work with traditional allopathic medicine. So let's go ahead and talk about the learning objectives first. So our first learning objective will be able to define allopathic medicine, explain how massage reemerged in the United States as complementary medicine. We're going to be able to define CAM, differentiate among terms alternative, complementary, holistic, and integrative medicine, explain the role of massage in integrative medicine, describe the role of the patient in integrative medicine, explain how chiropractic care and the massage practice may be combined, explain how massage might fit into a hospital setting, define medical massage, and demonstrate billing insurance for massage. So why study massage in medicine? The massage therapy student should have an understanding of the use of massage in medicine because an understanding of recent acceptance of massage from alternative to complementary to integrative medicine and then into mainstream healthcare will help the therapist who is interested in pursuing medical massage. So we have gone from being like, yeah, you can do massage if you want, to medical professionals actually seeing the benefits that massage can provide. Being able to communicate with medical personnel and understanding charting and safe practice protocols for treatment of specific pathologies are requirements for practicing medical massage. Massage that is prescribed by a physician and done in a medical setting may be covered by insurance. Understanding insurance billing may be an important adjunct to a massage therapy practice so that you can properly document with insurance, and so that you are being compensated properly with insurance, you need to be able to understand how it works. So, outline massage in medicine throughout U.S. history. As learned in Chapter 1, the history and advancement of therapeutic massage, manual therapies like massage and massage-like procedures have been considered part of the medical practice since ancient times. Massage practices of physical manipulations and applications have also flourished in non-conventional healing practices and folk medicine. So we cross this line, right? We're able to move back and forth between these two worlds pretty easily. So go ahead and highlight here. After falling into obscurity in the 1950s, massage began to reemerge during the human potential movement of the 1960s and 70s. The reemergence of massage in the United States happened outside of allopathic medicine. Now, if we look over here in our little purple box, I want you to go ahead and highlight allopathic medicine. Allopathic medicine is mainstream medical practice using pharmacological agents or physical interventions to treat or suppress diseases or injury. Classic Swedish massage was joined by reflexology, shiatsu, acupressure, and other alternative practices. More therapeutic modalities began to emerge, each carrying the name of the person who devised it, such as Reichian therapy, Rolfing, Alexander technique, Feldenkrais, and Traeger, among others. Cross-fiber techniques of James Sirax and trigger point therapies described by Simons and Travell gain acceptance and popularity. Go ahead and highlight here. English osteopaths Stanley Leaf and Boris Chatow developed neuromuscular technique, and Leon Chatow has written extensively to clarify and expand his uncle's work. In the United States, neuromuscular is known as, or NMT is known as neuromuscular therapy, and was popularized by Judith Walker Delaney and Paul St. John. John Upledger developed craniosacral therapy. In the 1980s, massage gained popularity among athletes because of its ability to reduce stress of intense workouts, enhance performance, and promote healing of soft tissue injuries. Many techniques found to be effective when addressing soft tissue conditions in athletes were also effective for hypertonic or dysfunctional conditions in the general population. Massage had turned a corner from being simply relaxing and feeling good to being therapeutic and directed towards improving a person's physical condition. All of these modalities were developed outside of Western medical practices and were considered alternative practices. More and more people began to regularly seek the services of these alternative practitioners to help maintain and improve their health. Go ahead and highlight here. Massage and massage-like practices were accompanied by a wide array of health and healing practices that were considered alternative medicine. All right, so explain alternative and complementary medicine. We're going to highlight here. The term alternative medicine implies that people were seeking services of alternative health practitioners instead of going to allopathic physicians. So they were choosing a massage practitioner as opposed to a regular MD physician, whatever. End your highlight. In fact, many were using services of conventional doctors and alternative practitioners for the same physical conditions. Often, this was done without clients informing their medical doctors that they were visiting alternative practitioners at the same time. In the 1980s, the term complementary medicine emerged and began to gain popularity, implying that alternative practices could work along with more conventional medicine for the benefit of the client. A change in terminology was accompanied with the change in attitude. Some alternative practices, massage among them, are becoming more socially acceptable and in the medical community. More acceptable socially and in the medical community, excuse me. The establishment of the National Center of Complementary and Alternative Medicine as a part of the National Institute of Health generated increased research in CAM therapies. Senate Bill 2440 established the NCCAM in the fall of 1998. On July 13th, President Bill Clinton, by executive order, appointed members and the chair for the White House Commission on CAM policy to help develop administrative and legislative recommendations to increase benefits and protect the public by providing consistent and credible research. Results of clinical studies have been published in the Journal of American Medical Association and other prestigious scientific and medical journals. Research continues at hospitals, clinics, and academic institutions across the United States. Because of these reported findings, more medical doctors are supporting the use of various CAM therapies along with prescribed medical care. More doctors are also using CAM therapies for their own health maintenance. Go ahead and highlight here. Nearly 1/2 of US medical schools are offering some education on CAM. Okay, so they're realizing, or realized in the medical community, how valuable massage and therapies like massage could be. Complementary and alternative medicine encompasses several healing practices, philosophies, and therapies that conventional Western medicine does not include, study, accept, or generally offer. So let's go up to Massage Corner 20.1. We're going to define CAM. The panel on definition and description, CAM Research Methodology Conference, Office of Alternative Medicine, NIH, Bethesda, Maryland, April 1985, defined complementary and alternative medicine as a broad domain of healing resources that encompasses all health systems, modalities, and practices, their accompanying theories and beliefs, other than those intrinsic to politically dominant health system of a particular society or culture in a given historical period. CAM includes all such practices and ideas self-defined by their users as preventing or treating illness or promoting health and well-being. Boundaries within CAM and between the CAM domain and the domain of the dominant system are not always sharp or fixed. So let's come down to alternate versus complementary versus holistic versus integrative medicine. So complementary and alternative medicine encompasses many therapies that have developed outside the Western medical model and are not necessarily based on surgical or biochemical theories. The term CAM is well recognized partially because of the creation of the 1998 NCCAM at the NIH. Other terminology is often used interchangeably, such as holistic medicine, mind-body therapy, or integrated medicine, although each of these terms has special considerations. Let's go ahead and highlight here. Holistic means to look at the person, look at the whole picture. When applied to health, holistic takes into account the whole person, not just the symptoms. And your highlight. Hi, Stacy. All of the things affecting health of a person, including spiritual, physical, mental, emotional, social, and environmental factors, are considered. Let's look at Massage Corner 20.2. We see CAM modalities. This is a list of CAM modalities, but it's not comprehensive. It's not every CAM modality you will find. This is just a partial list. So here we see acupuncture, Alexander technique, aromatherapy, Asian bodywork or therapy, Ayurveda, biofeedback, chelation therapy, Chinese herbal medicine, chiropractic, color therapy, deep breathing exercises, diet therapy, folk medicine, glandular therapy, guided imagery, herbal medicine, homeopathy, humor therapy, hydrotherapy, hypnosis, light therapy, massage, meditation, movement therapies, music therapies, naturopathy, neurolinguistic programming, nutrition counseling, pet therapy, prayer and spiritual healing, progressive relaxation, Reiki, shiatsu, sound therapy, visualization, and yoga. Just to name a few. So in Massage Corner 20.3, complementary or alternative. In 2002, the medical subject heading section staff of the National Library of Medicine classified alternative medicine under the term complementary therapies. This defined therapeutic practices are not currently considered an integral part of conventional allopathic medicine medical practices. Therapies are termed complementary when used in addition to conventional treatments and alternative when used instead of conventional treatments. Right, so those terms kind of explain themselves when they complement medical or they're used instead of alternative. They are the alternate. All right, so continuing on this page, holistic treatment can include medical intervention combined with music in a conducive setting, while the patient would also receive massage, acupuncture, Reiki, or hypnosis, and participate in a support group. Holistic approaches also emphasize wellness, healthy lifestyle, and active participation by the person in her healing process. Diet, imagery, positive thinking, meditation, and motivational tools are commonly used together. So the outlook here is that the patient has a role to play in their well-being. Mind-body medicine considers the power of the mind or thought processes and their effect on the physical body. Techniques include positive attitude, hypnosis, and guided imagery, as well as meditation, relaxation techniques, Tai Chi, and yoga. Mind-body response and supported by studies in the psychoneuroimmunology and is the source of healing from within, spontaneous healing, and the placebo effect. Integrative medicine combines complementary and alternative medicine with allopathic medicine. Ideally, an integrated model, a healthcare team, including doctors, massage therapists, acupuncturists, nutritionists, and other selected health providers, and the patient meet together and cooperate to create a plan to best benefit the health maintenance of the patient. Integrative medicine effectively combines the high technology and high touch to provide the best overall support for the patient, recognizing that mind, body, spirit, emotion, and environment all play a part in healing the person as a whole, in which no system has all the answers. Many resources can be combined to support health on many levels. So everybody comes together to create a plan for that specific person. According to Andrew Weil, alternate insinuates instead of, complementary indicates a nice add-on, fluff, and integration is a true coming together and cross-acceptance of medical models. It is a meeting of minds, worlds, and philosophies. In keeping with Weil's model, he is training physicians in the practice and implementation of integrative medicine. In this model, the physician is still the director and decides which course to take, whereas in a true integrative model, the patient would be the director. Innately, patients know what they need. If they are interested in their health, they can make choices when given appropriate information. So what they're saying here is you come to the patient and you provide your facts, and then from there, the patient is going to choose the avenue in which they will pursue their healing. So let's describe integrative medicine. Integrative medicine combines conventional allopathic medicine with appropriate complementary and alternative medicine modalities to provide the highest benefit to the client. Integrative medicine programs focus on assisting patients in creating customized wellness plans for optimal health that are as responsive to the patient's initial concerns as they are to the plan's patient's changing health needs, taking into consideration all aspects of well-being. These plans include recommendations from a wide range of appropriate therapeutic interventions from both conventional and complementary alternative practices. An integrative program might include conventional medications and diagnostic medical screenings and examinations, herbal supplements, oriental medicine and acupuncture, physical therapy, nutritional therapy, diet recommendations, movement, and exercise assessments. The plan might also include stress reduction, mind-body interventions such as biofeedback, massage, art, and music therapy, yoga, and meditation. Above all, these plans are founded in mutual trust and respect between patient and practitioner, with the understanding that each person has a significant innate capacity for healing that can be supported and enhanced. By combining modalities to reduce symptoms, enhance ability to control pain and anxiety, and better managing the stress and improving quality of life, integrative medicine is particularly successful at assisting patients who have chronic medical conditions, patients with chronic health problems ranging from arthritis to headaches to life-threatening illnesses such as heart disease and cancer, combine traditional medical care with integrative methods to ensure that their physical and emotional well-being is addressed. Right, so they're just not a chart with a list of medications and blood tests. They take in consideration the person as a whole. Go ahead and highlight here. A close collaboration among physician, integrative medicine team, and the patient helps choose treatments and services that can be thoroughly integrated into the patient's overall medical care. Right. Describe patient's role in integrative medicine. Integrative medicine is a healthcare program that is principled in science and tradition, in which the patient is treated as a whole person and respected as an individual being. The patient is an integrative medicine in an integrative medicine program is encouraged to participate fully in healthcare choices to attain optimal health. Patients are listened to and treated with respectful consideration as a partner in the development of their health plan. They are given recommendations founded in Western or conventional medicine, combined with appropriate lifestyle recommendations such as diet, exercise, appropriate CAM treatment, options such as herbal medicine, acupuncture, massage, biofeedback, yoga, stress reduction techniques. A care plan is tailored to fit each patient's needs and to honor each patient's personal healing process. The patient is also given the help needed to sort through the myriad of complexities within complementary alternative medicine and conventional health options to optimize a health plan that is right for the person. So they really get it's not a one size fits all health plan. Each person is going to be quite different because everybody lives their lives quite differently. Centers of integrative medicine. Many health centers and hospital complexes around the United States have open centers of integrative medicine. These centers offer a variety of alternative or complementary health services in conjunction with mainstream Western allopathic medical practices. Practitioners from a wide variety of CAM modalities are available to provide their services. Each practitioner is a part of a health team, integrating services to support and enhance the health and well-being of the patient. Many of the integrative health services provide wellness services to hospital staff, outpatient services to people in the community. Many also provide services for hospital inpatients in certain circumstances and under supervision of the medical staff. Because integrative clinics are connected to hospitals, the CAM modalities used in those clinics, are gaining acceptance and recognition by parts of the medical community and the community at large. So what they're doing here is someone who wouldn't necessarily be into these more alternative therapies, we kind of get a little bit of a backbone when we're supported by the medical community. When we have someone who has their medical degree say, yes, I have quantitative proof that this can improve your well-being, someone who's a little bit apprehensive might be more willing to try something that they wouldn't necessarily have if they didn't have someone backing it up. And not to say that we need to be legitimized in that sense, but there are people who just simply don't have an understanding of the way alternative therapies work. Where was I? Integrative medicine programs see themselves as agents of change dedicated to the transformation of healthcare from a disease-oriented, physician and technology-centered model into a wellness, patient-centered orientation that understands and empowers the integration of body, mind, spirit, community in healthcare. So what they're trying to do is away from the days of just being a chart, get them in, get them out, do the most, treat the symptom as soon as they see the symptom, not necessarily figure out what is causing the symptom, which has been the model for Western medicine for a long time. We can stop your symptoms, but we don't know what causes them. I mean, in layman's terms, not necessarily. Obviously, if you have nausea, vomiting. They want to figure out why you are nauseous and vomiting. But by and large, as a whole, it's treat the symptom, not so much the cause. And turn the page. Medical community. As the medical community gains a better understanding of the level of interventions available from different types of massage and other CAM therapies, patients will benefit by integrating CAM and conventional medical practices with their physician's referral, recommendations, or at least knowledge and cooperation. Patients' report of positive outcomes from the use of CAM modalities are part of what changes the attitude and opinions of the medical community. Educating the medical community and the community at large is an ongoing function of the integrative clinic, the practitioners who practice there, and the participants who benefit from the services. So when you have someone saying, you know, I tried X, Y, and Z, and then I went this route, and this is what has helped me, you start to change minds that way. So, massage and integrative medicine. Let's highlight this first sentence here. Massage is often the first choice, or at least at the top of the list for patients using integrative medicine. Massage is mainstream enough for people to recognize it's kind of like they're dipping their toe into the water of alternative medicine. And then they start getting massage, and then we open the magic door and say, look, there's all this other stuff behind this door that you can, research, learn about, and decide if it's right for you. All right. Massage therapy might be the remedy for a specific condition, or it might be an adjunct therapy to complement the therapy regimen. Massage therapy is one of the most effective CAM modalities for relieving stress and managing pain that is associated with so many pathologic conditions. It is one of the most popular and requested CAM modalities and is the mainstay of the CAM and integrative clinics. Massage modalities. Just as there is numerous complementary and alternative practices in integrative medicine, there are also many different styles of massage therapy, massage and touch therapies used in integrative clinics according to the circumstance and need of the patients or clients. Some variations of somatic therapy found in integrative clinics include Swedish massage, neuromuscular therapy, trigger point methods, cranial sacral, Rolfing, manual lymph drainage technique, infant massage, pre and postnatal massage, and energy modalities including Reiki, therapeutic touch, and Shiatsu. Classic Western or Swedish massage is very possible when a client is seeking respite from the rigors of more stressful conventional medical treatments. Circumstance might prompt special considerations such as cancer treatments, AIDS, prenatal care, preoperative preparation, say that 3 times fast, post-surgical recovery, or recovery from traumatic accident. Lymph drainage therapy is offered in many integrated clinics to assist patients who experience lymphedema following a surgical removal of lymph nodes or other congestive conditions. Massage increases relaxation, promotes well-being, and reduces anxiety in patients undergoing more invasive therapies. Massage is about touch and human contact and is the key to wellness. So many times you will hear me say there's power in human touch. Sometimes people who, especially in the older population, are coming to get massage. You may be the only person besides their doctor that lays hands on them, right? And so that in itself is healing, because I don't know about you, but being quarantined and not being able to go anywhere and not being around people, and when I see my family, because they all work in hospitals, I can't hug them, and not being able to have that touch, it really affects a person. So to be able to go to someone and have that positive touch is very, very powerful. Where was I? Oh, here we are. Massage services that are specific to the client's condition can also be requested. This might be a request of the patient, the suggestion of the integrative team coordinator, or a prescription from the client's physician. Specific massage might be orthopedic massage to reduce pain and increase range of motion, or ROM, and the function to a particular body area, or scar tissue massage to reduce detrimental effects of excessive scar formation. If there is any consideration of submitting billing to insurance, a prescription from a client's physician is required. More on insurance billing can be found later in this chapter. So we will get to that. Working in an integrative clinic. The experience of working in an integrative clinic helps the therapist become more aware and knowledgeable of other therapies. A massage therapist who is knowledgeable about other CAM therapies is able to suggest other CAM modalities and refer clients to other therapists who might be able to support the client in her healing journey. Massage becomes a doorway to open clients to using other CAM modalities. And especially when you do open that door to CAM modalities, the other CAM modalities, you have established trust with that client. And so for you to be able to say, you know what I do, you know what I feel, and you can trust me, right? We're building rapport with that person. Working in an integrated system, especially a hospital-related program, requires a massage therapist to follow set guidelines and protocols. Protocols are established for each CAM service offered. Protocols and procedures delineate the standard of care to the patient, define relationship and communication between practitioners, staff, and administration, reflect professional standards, and ensure that all practices are within the policies of the hospital and other legal entities. The Joint Commission on Accreditation of Healthcare Organizations, or JCAHO, routinely reviews hospital operational policy and practices before providing accreditation for their continued operation. During these surveys, protocols, policies, procedures must be clearly stated and meet professional standards before the hospital or program is accredited. So they have certain bars that they have to meet before they can be accredited by JCAHO. Competency requirements. If an integrative clinic is in a hospital department or massage therapists are employed by the hospital, therapists might need to meet certain competencies for the hospital to maintain its accreditation. These competencies might be evaluated through written tests, hands-on demonstration of competence, verbal examinations, or combination of the three. If a massage therapist working in a particular department, such as a birthing center, is doing postpartum massage, she will be required to show she has a knowledge of positioning the patient, understands precautions about working with new mothers, and is knowledgeable about epidurals or cesarean sections. There might be a competency examination for each massage modality. Right. Record keeping. Please keep detailed, accurate records. Right. Clear and accurate documentation is required when working in an integrative setting. Go ahead and highlight here. When working in an integrative clinic, especially in a hospital setting, a massage therapist must follow hospital regulations regarding patient safety, record confidentiality, and patient information. Right. This model should be followed no matter where you are documenting. All right. Patient records provide a communication from patient to provider and from provider to provider. There we go. Records must be accurate, stating what the particular practitioner saw and did. Accurate records become the communication tool among various modalities, which means by which the coordinator follows the patient's progress and counsels the patient regarding healthcare decisions. So you need to be able to make sure your message is being conveyed in your notes accurately so that the next practitioner can understand what you did for the patient. Documentation of massage services include the patient's chart. Clear, concise language describes the services provided. Documentation of massage includes assessment, type of massage given, effects of the treatment, and any physical observations, and follow-up recommendations. Most hospitals use central charting system in which all healthcare providers, doctors, nurses, physical therapists, and CAM practitioners document in the same chart. The SOAP charting system, as we talked about on Monday, documentation is commonly used in the medical community and is well suited to CAM practices. However, many settings use a descriptive explanation of services. The practitioner should learn and follow the document procedure that the facility uses. So in the event that you do work for a medical facility, they will show you how they want things documented. All right. Integrate chiropractic and massage. Let's go ahead and highlight this first sentence. Many massage therapists work in chiropractors' offices. Okay, and highlight. The relationship between the chiropractic and massage practices vary between offices. Often, the massage therapist is an independent contractor who simply rents a space in the chiropractor's office. The massage therapist might be responsible for scheduling his own appointments and might work entirely independent from the chiropractor. On the other hand, the office receptionist might handle all scheduling and billing for services. Occasionally, the chiropractor might refer one or more of his patients for massage when soft tissue conditions need to be addressed. The chiropractor might suggest that the patient receive short massage before an adjustment because it helps her relax and repairs the tissue so that the chiropractic manipulations are easier and more effective. Some patients prefer massage after being adjusted by the chiropractor. They think that the effects of combined treatment far exceed the effects of either treatment given by itself. The chiropractor might also diagnose a soft tissue condition and refer the patient to the massage therapist for several therapy sessions. Chiropractic and massage work very well together. Not to say that you can work very well with every chiropractor because all people are different. But the way that those two therapies work together, I mean, it just makes sense. When you are trying to manipulate a bone that has deviated from its home, what's pulling on that bone? Muscle. So you must affect the muscle to affect the bone. So when those two work together, we get a much better benefit from both therapies. I've never personally worked in a chiropractic office, but when I did have my own business, I had several chiropractors that I would communicate with my clients, where we would have plans of action to work together to make sure that they were getting the most from both of us. Right. Massage and chiropractic therapies together can address structural alignment issues in the soft tissue conditions that so often accompany them. The massage therapist spends the time to work the soft tissue to increase circulation, reduce spasms, deactivate trigger points, and increase range of motion. The chiropractor is then easily able to adjust the spine and other joints to improve the overall structure and function of the client. So if we can adjust, or we can affect, the soft tissue, and where we might have been having a pull against, and now we have gone ahead and deactivated those trigger points and softened all that tissue. Now the pull that was on the specific bone that was going to be adjusted, now they don't have to fight against that soft tissue, right? All right, summarize hospital-based massage. Hospital-based massage, as its name suggests, consists of any form of structural touch or energy work that takes place in a hospital environment. The therapist might be employed by the hospital, could be an independent contractor, or even a volunteer, or work through an associated hospital program, such as an integrative clinic. Sometimes the therapist is associated with a physical therapy department. Therapist services can be available to the hospital staff, patients, patients' families, and outpatients. Massage is offered to hospital staff, usually in the form of 10 to 20-minute chair massages that take place during a break for the purpose of relieving stress and tension. Let's go ahead and highlight here. Benefits of massage to staff include decreased staff turnover, increased productivity, improved morale, decreased sick time, decreased worker compensation claims, and improved quality of patient care. Powerful stuff. All right, prescriptions and insurance. Providing massage services to patients requires a recommendation, referral, or prescription by the patient's doctor. Even without a prescription, the physician must provide a recommendation or release for massage. A prescription is required before any third-party insurance coverage payment can be pursued. If the therapist is working as an employee of the hospital and has a prescription to provide massage, insurance reimbursement might be available through the hospital's patient billing services. Usually, the patient requests the massage. Services are generally provided on a cash basis, whereas the patient pays the therapist directly. Services offered in hospital environments. Services are usually performed with the patients in a hospital bed, so the therapist must be conscious of their ergonomics when working around the hospital bed and medical equipment. The therapist might encounter a wide variety of fragile medical conditions. The therapist must have an understanding of and give careful considerations to medical equipment, meaning catheters of many types, ports, HEP blocks, PCA pumps, compression boots, IV poles, pulse O2 machines, nasal cannulas, compression leggings, BP cuff on the patient, and monitors that might have been around the hospital bed and connected to the client. The massage therapist must have a clear understanding of related pathologies and indications and contraindications specific to each client when working in the hospital environment. So you have to have a large knowledge base to be in the hospital setting. And of course, that comes with additional training. Effects and benefits on various illnesses. Hospitals can seem impersonal and intimidating. Receiving a massage from a caring massage therapist helps relieve the feeling of being institutionalized and improve the patient's overall sense of well-being. Let's go ahead and highlight here. Benefits of providing massage to patients include improved sleep, reduced need for pain medication, and more satisfaction regarding patient care. We're going to continue highlighting. Some hospital areas in which massage is performed include prenatal, postnatal, preoperative, and cancer treatment areas. Massage before surgery helps reduce the patient's anxiety and seems to reduce the time spent in recovery. We're going to keep highlighting. Prenatal and postnatal. Massage services have become common addition to birthing centers. End your highlight. Massage helps promote relaxation during the birthing process. We're going to highlight here. It also helps reduce the back pain often associated with labor. Keep highlighting. Acupressure can help stimulate contractions and ease the birth process. All right. So cancer treatment areas. Massage during cancer treatment provides a service that feels good when most treatment feels bad. Given before invasive treatments such as radiation or surgery, massage can help reduce anxiety. Massage has also been found to reduce pain. After surgery and the initial healing, massage can help to reduce scar tissue, relieve edema, and help the client regain a better sense of self. Cancer treatments can be quite traumatic, so having massage in congruence with cancer treatments can kind of not so much create a buffer, but ease them through cancer treatment. I think that's a good word, I guess. All right, rehabilitation. Massage is valuable after trauma, such as motor vehicle accidents, to help people reintegrate their own bodies. which many times have gone through radical changes. Massage is also helpful in treating injuries of soft tissues and joints and is prescribed in a wide range of conditions. Massage is used in some cases to treat nervous fatigue, insomnia, headache, tension, stress, and other disorders. Massage is often effective for pain management, especially when medications aren't working well. It is helpful to do a pre and post massage pain level score to be included in the patient's chart to help market future massage programs. Right. I have found more recently with the sort of implosion of the opioid epidemic that people who were suffering with pain from car accidents were less likely to get a prescription from their doctor of an oral medication and more apt to get a prescription for massage. I don't know the details of it. That's just what I saw as a theme coming through when I was working. I think more like small time fender bender accidents is what I was seeing that in, not in your traumatic case injuries. Aid in healing. In a hospital setting, massage is used as part of a physiologic and psychologic rehabilitation process. When a person becomes ill or is injured, it is common to feel a sense of apprehension, insecurity, and anxiety, which often leads to restlessness and insomnia. A good massage increases the patient's comfort, reduces relaxation, and helps relieve anxiety. When a patient is confined to a bed for a period of convalescence, muscles lose their tones, joints become stiff, and skin develops sensitivity. Unless the patient is turned or can move, bed sores might develop. Massage helps prevent these problems. So if they aren't moving themselves, they aren't able to get up and out of the bed, and you come in and you can help facilitate those tissues to, in a way, move and get the proper nutrition that they need, lots of these ailments can be prevented or at least severely lessened. In addition to increasing the patient's comfort, massage aids healing by increasing the number of white and red blood cells and by improving circulation, which in turn nourishes the tissues. Lymphatic drainage, when performed correctly, improves the action of the lymphatic system. The therapist should be certified in lymphatic drainage therapy before working on any patient in a hospital setting. So you need that additional training. Go ahead and highlight here. Massage is used to prevent constipation by improving the peristaltic action of the small intestines and colon. So that's that pulse that helps move things through the digestive system. We can aid in increasing that. Right. Massage has been found to benefit patients of all ages in numerous ways. Many doctors recommend it as an aid to a speedier recovery. Special considerations in hospital environments. Often massage services are modifications of classic Swedish massage to help soothe and reduce stress. Massage for inpatients is generally very gentle and soothing. Sometimes may consist of only 10 to 20-minute foot or hand massage, providing a compassionate connection to the patient and a reassuring feeling that things will be okay. Usually, special considerations and precautions must be observed because of the population receiving the massage services. It is essential that the massage therapist be knowledgeable of pathologies present, the treatment, the medications, be aware of the indications and contraindications for massage, and follow recommendations of the attending physician. The therapist must also understand that each individual is unique within their experience of the disease and treatment, and each individual will be different from day to day. Massage therapists should never answer questions about the patient's medical conditions or treatments, but instead empower the patient to speak with their nurse or physician about their concerns. In an environment in which most procedures tend to be invasive, There is not much touch that is sensitive to a person. By providing services like massage and therapeutic touch in the hospital, massage practitioners can bring compassionate touch back into healthcare. So many times you see this when the nurse comes in and the patient gets a grimace on their face because they know there's either going to be some sort of poking, prodding, a needle prick, something of that sort, something that's not going to be pleasant. So when a massage therapist comes in or another touch therapist, that it's going to be a positive touch. It's going to be something that they will enjoy, that will help them feel better. So it's kind of the light at the end of the tunnel, you know. Well, yeah, I had all this going on, but at least I got a massage, you know, something that helps them carry through and keep that positive attitude, because it's hard to be in a hospital for days or weeks or months at a time. All right, contraindications for massage in healthcare. Unlike the practitioner who works with healthy clients, the massage therapist in the healthcare setting often works with people who are ill, injured, or recovering. The stage of the person's illness and injury often determines which extent the massage might be given beneficially or whether it should be given at all. Remember that massage must be approved by the patient's physician. Massage provides many benefits and is valuable adjunct therapy, but sometimes massage must not be given to or near an affected part. The patient's physician will note deterioration of muscle or skin that could benefit from massage, and will also note any contraindications for massage. The therapist does not apply massage in cases of illness or injury without supervision or permission of the patient's physician. So we have some general contraindications here. We have bleeding, which is internal or external. Skin problems such as rashes, growths, or lesions. Newly formed scar tissue, scabs, wounds, and burns. Infections, swollen areas, pain, inflammation, and heat in the area. Nausea, vomiting, and fever. Edema, which is excessive lymph fluid, often causes swelling in feet and legs, particularly in elderly. The direction of lymphatic flow. Sometimes physician recommends effleurage or lymph drainage therapy in the direction of the lymphatic flow to help relieve this condition. But again, you must have that proper training. Varicose veins. Veins in the legs become dilated and lengthen owing to the increased blood pressure. In mild cases, massage may be performed on nearby areas, but not directly on the affected part. Inflamed joints, such as arthritis and bursitis. Massage is not performed in the area when it is painful and inflamed. And cancer. When symptoms of cancer is detected or any condition is suspected to be cancerous, massage is avoided on or near the area. All right, let's go ahead and highlight this next section. Warning signs for cancer. The following are warning signs that are associated with cancer and are contraindications for massage. Clients who show any of these signs should be referred to a doctor. Any sore that has not healed normally, a mole, skin tag, or wart that is changing in color or size, lumps underneath the arms or in the breast, persistent hoarseness, coughing, or sore throat, abnormal functioning of any internal organs such as changes in the bladder or bowels, discharge or bleeding from any part of the body, persistent indigestion, or difficulty swallowing. I don't know about you, that makes me kind of like a hypochondriac. All right. Do we have any questions so far?
Nope.
Okay. Define medical massage. Currently, massage and manual therapies are experiencing a resurgence in popularity within the healthcare profession. As research continues to verify the benefits of massage and patients continue to profess its value and request referrals from their doctors for massage, more doctors are writing prescriptions for massage. Some of these physician-prescribed massages take place in hospitals and integrative medicine or medical centers. However, most of the time, medically prescribed massages occur in the office or studio of the independent massage therapist. A massage to address a condition diagnosed by a physician must be considered a medical massage. Excuse me. Medical massage is sometimes defined as medically prescribed massage performed with the intention of improving pathologies diagnosed by a physician. Medical massage is generally practiced on patients to bring about medical goal for health improvement. Medical massage is part of the medical treatment. The goal of the medical massage therapist is to provide medical massage, is to apply techniques that positively and directly affect the diagnosed condition. The therapist must be familiar with pathologies involved with the therapeutic modalities that positively address the conditions. The therapist might use a variety or combination of modalities or procedures during the treatment, such as Swedish massage, neuromuscular therapy, craniosacral therapy, myofascial release, lymphatic drainage, massage for cancer patients, orthopedic massage, trigger point therapy, soft tissue mobilization, or acupressure, depending on the condition and skills of the therapist. Medical massage is specifically directed to resolve conditions that might have been diagnosed by a physician and focuses treatment on the areas of the body related to the diagnosis and prescription. So what they're saying here is when you have a patient or client come in with a prescription, you need to be well versed in what they have been diagnosed with, right? And be able to have the tools in your tool belt to be able to affect them. So let's look at Massage Corner 20.4, a case of neck pain. A prospective client comes for a massage for relief of headaches, neck and shoulder pain, and pain and tingling in her arms that has been intermittent but persistent since an automobile accident she was involved in several months ago. Before proceeding with any massage treatments, the therapist refers the client to her physician for a full examination and an accurate diagnosis. The client can also request a prescription from the physician for the massage and provide for release of medical information, so the massage therapist may contact the physician. In doing so, the massage therapist protects the client and himself by making sure there is an accurate diagnosis and there are no hidden medical conditions. Having a prescription for massage also opens the possibility of obtaining insurance coverage for the massage services. This increases the likelihood of more extensive and consistent massage services to achieve lasting relief for the client. Right? So what they're saying here is, instead of just proceeding with the massage and be like, yeah, I can help you, they went through the proper avenues to make sure that they were comprehensively evaluated by their doctor, and that anything that may have been underlying that the massage therapist may not have been able to diagnose, because we don't diagnose, will be presented and affected accordingly. All right, where were we? Medical massage treatments. Medical massage is directed toward a diagnosed medical condition, or at least given the consideration of medical condition being present. The massage might be directed towards a soft tissue condition to improve function, relieve tension, increase range of motion, and or relieve associated pain. Massage can also be prescribed to help manage stress and anxiety related to pathologies or medical conditions that are otherwise unaffected by the massage. Therapeutic procedure. Medical massage sessions follow a therapeutic procedure, see Chapter 17. The prospective client comes to the session with some condition or injury and seeks massage to remedy or improve the medical condition. A physician or chiropractor has previously diagnosed the condition, and the client has a prescription or recommendation for massage. A concise health and client history helps the therapist better understand the client's conditions and concerns. A thorough assessment at the beginning of the first session further determines the tissues involved. Therapists must have an acute awareness of indications and contraindications for the diagnosed conditions. Techniques are chosen, a care plan is created, and treatments commence. The therapist continually addresses the tissues and responses of the client while performing appropriate techniques to address the condition. Massage services are directed toward the affected condition according to the doctor's diagnosis. Sessions of medical massage are usually shorter and more frequent. Full body massages are generally not warranted. When condition subsides or improves to a level where there's no further improvement, the goal for the treatment has been accomplished and further treatments are discontinued. So when they come in with a prescription, most of the time you are doing just that area. It's not an hour massage unless it was, you know, you really need to just relax and reduce your stress level. Why don't you try and go get a massage? And that's more of a recommendation from the physician as opposed to an actual prescription for a actual diagnosis. All right, learn about insurance reimbursement for massage. Massage therapists in many parts of the United States are experiencing the advantages and frustrations of obtaining reimbursements from insurance companies for the work they do on massage clients who have been injured and referred to them by a doctor or chiropractor. The decision to accept insurance cases into a massage practice requires some consideration of the pros and cons of working with clientele and their insurance companies. Some of the pros: working with clients can be very rewarding as they find relief from their injuries with soft tissue interventions of medical massage. With the doctor's recommendation and prescription, the regular massages are therapy that would otherwise be unavailable to the client. The cons: the therapist, however, must be willing to provide services to the client and prepare the necessary paperwork to bill the insurance company, and then patiently wait or battle for reimbursement while the insurance company processes the claim. Usually reimbursement payments are fairly prompt. However, the insurance company will sometimes request more information or review a claim. Sometimes the waiting continues for months or even years, after which the therapist's fees for service might have been reduced or even denied. So those pros and cons. You can facilitate a lot of consistent work by working through insurance with doctors, but I don't know if you guys have ever dealt with insurance, trying to get payments processed or billing processed, slowly turn the wheels of insurance. So payment to you, reimbursements, might be slow as well. So you have to take that into consideration. It's not like in a cash pay direct payment, you perform the service, they provide the money. It's not immediate. You're going to have to wait. Proper billing practices. Knowledge of proper billing practices reduces the frustration of resubmitting claims and increases the promptness and probability of being paid by the insurance companies. Proper billing requires close attention to detail when preparing claims, clear communication with the company agent, and accurate record keeping while documenting the client progress and billing information. So you want to over document in all reality. You want to have more paperwork than you would maybe need, just so you don't have to turn around and go, okay, well, I need this form as well. Here's that. Or we need this form too. Here is that. We want to send as much information as we possibly can for them so they can't turn around and say, well, we didn't have, insert whatever paper here. Insurance providers and coverage. There are a wide variety of insurance providers. Most do not reimburse massage therapists for the services provided. HMOs and PPOs will not cover the service of massage therapists unless the therapist is listed as a provider in the group. Even then, massage services are usually available to the subscriber only at a reduced rate. Let's go ahead and highlight here. Government health insurance, Medicare and Medicaid, does not cover massage services. Most major medical insurance policies do not cover massage therapy at this time. And your highlight. As massage becomes more recognized as a cost-effective alternative, however, this could change. This is changing. Yeah, in the year that this book has been updated, we've had many changes. Let's go ahead and highlight this next sentence. The types of insurance cases that are more likely to cover massage therapy are states' workers' compensation, auto insurance, and some personal injury cases. End highlight. In Washington State, Legislation was passed in 1996 requiring insurance companies to reimburse licensed massage therapists for services performed on patients when prescribed by a doctor. The state of Florida also has legislation that requires insurance providers to reimburse massage therapists for certain types of services. When a therapist decides to accept insurance cases, it is a good idea to start slow, learn the ropes, and become comfortable with the process. Begin with 1 or 2 insurance claims, learn the intricacies of correctly filling out and submitting necessary paperwork, and communicating with insurance agents. Proper filling of insurance claims requires considerable time. If the owner of the massage business decides to accept several insurance clients, she might want to consider contracting with a billing service to file claims, thereby leaving more time to see clients. Filling out these forms is going to eat up a lot of your time. So if you do plan to have that as your avenue, you want to be able to make sure that you are doing it as efficiently as possible. And sometimes that means hiring someone on to do it. All right, filing an insurance claim. The process in which insurance billing done is fairly standardized. Following a procedure when working with insurance cases and billing insurance companies can simplify the process and increase the chance of prompt payment from the insurance company. Organization, clear documentation, perseverance, patience, attention to detail, and promptness are required to reap the benefits of insurance reimbursement successfully. For a claim for massage therapy to be considered the insurance company, the massage treatments must be considered medically necessary. Okay, so that's our first hurdle. Medically necessary can be determined only by a doctor, chiropractor, or possibly physical therapist, and is documented by a letter of referral or a prescription. A referral to a massage therapist must include a statement of medical necessity, a prescription that includes a diagnosis of the condition, an order for services to be performed, the frequency of treatment, and how long the treatments will continue until the patient will be reevaluated by the doctor. The billing to the insurance company must reflect massage services as they appear on the prescription. If during the intake assessment, the massage therapist recognizes conditions related to the client's injury beyond those indicated by the doctor's prescription, the therapist can request that the doctor rewrite the prescription to include additional conditions so that they are included in the insurance claim. The client can return to the doctor and ask the related condition be added to the diagnosis, or the therapist can call and inform the doctor of his observations and ask whether the physician or consider amending the prescription. Otherwise, even if the therapist addresses the additional conditions during the therapy session, he may bill the insurance company only for the work done and the conditions listed in the prescription. So we have very strict parameters that you have to exist in when you are doing insurance billing. When making the first appointment with a new client, the therapist should determine whether it is an insurance case. If it is, the client is instructed to bring necessary information to the first appointment, or better yet, the therapist collects the necessary preliminary information over the phone to obtain verification from the insurance carrier before the client arrives for the first appointment. So there's a lot of legwork that goes in with this. All right, so verification and authorization. Let's highlight this little paragraph here. Before beginning any massage on a new insurance client, the therapist must obtain verification over the telephone from the insurance adjuster that the massage services are covered on the client's policy. The therapist should have the following information before calling for verification. Let's highlight this bulleted area. We need the client's name, the name of the policyholder if it's not the client, insurance company's name, the adjuster's name and phone number, the insurance ID number or social security number, the claim number, and the date of incident or injury. All right, so we got to get our ducks in a row before we can even make a phone call. So the therapist must also have the prescription and preferably a referral letter of the physician or chiropractor. The prescription should include a diagnosis and treatment plan to include the number, frequency, and duration of massage treatments given. Obtain verification of the following. Does the client have coverage for massage therapy services? Which current procedural technology codes covered? Is the limit on coverage in number of limits. What is left under the limit? Is there a deductible? How much is it and which portion has been met? When does the deductible renew? What percentage of fees does insurance reimburse? Is there a copay? What is it? If it is a workers' compensation claim, obtain an authorization to proceed. All right, and let's go ahead and define current procedural terminology codes. Current procedural terminology codes were developed and maintained by the American Medical Association, categorize and classify services, and provide common language and a base for communicating among physicians, therapists, patients, and insurance companies. Lots of times you'll see these referred to as billing codes as well. And then let's define copay. Copay is the portion of the fee for service that the patient is responsible for at the time of service. So that's what they pay before they leave. Workers' compensation. Let's highlight that first sentence. Workers' compensation requires authorization before services are rendered. And highlight. Any services provided before authorization is obtained do not have to be reimbursed by the insurance carrier. Rules for workers' compensation vary from state to state. Before accepting any claims, call the Workers' Compensation Division of Department of Employment in your state for information and ask for a fee for service manual. Workers' compensation is generally provided from an insurance company designated by an employer at the time of injury. By the time the client comes for treatment, she should have a prescription from the physician, the name of the claim agent or case manager, the agent's phone number and claim number. The prescription must include the diagnosis, the prescribed treatment, and the frequency of treatments during and duration of treatment, and the physician's license number and signature. The prescription must be prescribed massage therapy or include specific CPT codes that are written within the massage therapist's scope of practice. Communication tips for insurance reimbursement. When communicating with an adjuster and insurance agent, it is essential to document the conversation, record the date and time to the minute. Name the agent or agents and exactly what is said. If the agent transfers his therapist to another party, get the name and direct phone number of that person in case the transaction is disconnected. The massage therapist should always obtain verbal verification of the client's insurance coverage over the telephone before performing any services to that client. Telephone authorization verification must be followed up with a confirmation letter restating what was verified during the telephone conversation. Fax or mail the confirmation letter to the insurance carrier requesting written confirmation of coverage. All right. Documentation for an insurance claim client. During the initial interview, the client with an insurance claim completes several forms and preliminary assessment. At the initial interview, the client completes and signs a medical information release form and an agreement for payment form. The intake form and the doctor's prescription should have sufficient information to contact the insurance adjuster for verification of coverage. Let's highlight here. The medical information release form is required by law and allows the therapist to share information regarding the client's health related to the injury with the insurance company, other health practitioners related to the case, or lawyers or courts involved with the case. And highlight. Patient information is not shared or released without the patient's authorization and is only necessary information is provided and only to those professionals involved or related in the case, right? You can't call their dermatologist just because they're one of their physicians and you have a release form, right? They're not involved in this injury case. They don't need this information. All right, highlight. The agreement for payment form establishes the client's responsibility for any payment of fees that is not paid by the insurance company or in a court settlement, right? And your highlight. The client should also sign an assignment of benefits form, a copy of which is sent to the insurance company with the first claim so the carrier can send the claim benefits directly to the therapist for services performed. Another copy is kept in the client's file so that when sending future claims, the client is not available to sign forms. The proper blank can be filled in with signature on file. And so here we see on these 2 pages examples of our medical release form, our agreement for payment form, and our assignments of benefits form. And the Massage Corner 2020 talks a little bit more about each form in-depthly. Hi.
The fire alarm is about to go off. They're just testing it. Everything's fine.
Okay. We're gonna hear buzzing with the fire alarm. It'll be shut off shortly. We just have to test it. Receipts for services. Another important form when working with insurance companies is a receipt for services. The receipt should include all the following necessary information, or necessary for the insurance company, the client, the therapist regarding the session. The receipt should include the following information. So we're gonna have the client's name, the date of service, the description of service. I want you to highlight this bullet here, the ICD-10, which is the diagnosis, and the CPT procedural codes. All right. We're also going to have charges for the service, payments and adjustments, previous and current balance, the therapist's name, address, phone number, provider phone number, if there is one, client's next appointment. Oh, there's not an alarm exactly in here. That's great. All right. So before we get into this next little session, I want you to come to this little purple box down at the bottom of the page where we see 1500 health insurance claim form. I want you to highlight that. It is a standardized form created by the Healthcare Financing Administration to be used by service providers when billing insurances for medical expenses. All right, so this is on the following page, that exact form. And it's been standardized. So when they say they need the 1500 health insurance claim form, this is what you fill out, not a version of it, not an interpretation of it, this specific form. Okay. Massage session protocol. During the initial evaluation, the therapist carefully documents any conditions relevant to the client's injury or complaint. The physician's prescription designates specific areas of the body to apply selected procedures. The tissues in the designated area or areas are assessed with palpation, and the condition of specific muscles is documented on preliminary assessment form. Tension, trigger points, hypertonicity, hypotonicity, inflammation, swelling, and other conditions are indicated. Following the session, changes to these conditions are documented. When performing medical massage or filing for insurance payments, every massage or therapy session must be clearly documented. Usually, this documentation is kept in the client's file and is not included when filing claims unless requested by the insurance company. A narrative SOAP note style, which we talked about on Monday, is preferred. The therapist might be required to submit documentation to the insurance companies if the case goes to court or to attorneys. Therefore, it is imperative to keep clear, concise client records. When performing massage for medical purposes, whether at the request of the physician or from the prescription or when expecting reimbursement from insurance, it is essential to keep accurate documentation for each and every therapy session. We can't just take notes for the first session and apply those notes to every succeeding session. We need to document every single time that person is in our care. Documentation includes forms completed during the intake procedure, individual session notes, and receipt of services. Progress or session notes documented each session help the therapist and the client follow a course and progress of treatment. Documentation is required for communicating with others, such as medical personnel, insurance companies, and even lawyers or the courts. Clear session notes provide documentation that the session happened. They also show proof of progress, which is vitally important to insurance companies as they review and determine continued payment of benefits. Insurance companies pay only for services that are deemed medically necessary. The insurer determines medical necessity by reading documentation presented by the service providers, the client's medical history, especially related to the current injury or condition, the referral and prescription from the doctor, the initial assessment, and progress notes are essential documents with which the insurer determines whether to reimburse for the massage therapy services. Oh, there it goes again. Client files. Most of the documentation remains in the client files except for the receipt of services. A copy is given to the client. A copy is kept in the file for bookkeeping. Copies of the client's medical history, initial assessment, physician's referral and/or prescription, session notes, and the assignment of benefits will accompany the 1500 health insurance claim form as attachments with the initial claim that is sent to the insurance company. It is very important to keep copies of everything that is sent to the carrier. You will not get your originals back. You have to keep a copy of everything. You write a sheet for that client, make a copy of it, you keep it. Follow-up submissions of claims for the, did I miss a page? Oh, nope, down here at the bottom. For the same incident might require only the 1500 insurance form unless the insurance company requests session soap progress notes and a copy of the prescription with each claim submission. So they will tell you exactly what they want. You just have to make sure that you have it. The therapist should ask the claims adjuster during the initial verification to determine the particular company policy regarding which documentation accompanies the claims, submitted claims. So find out what you need before you need to send it, instead of having to have them call back and be like, well, we didn't get this form. We also need this form. We need this form as well, right? We want to send it all in bulk, ready to go, so the claim is processed in a timely manner and you're paid in a timely manner. SOAP notes. We talked about this a little bit on Monday, so we're going to kind of breeze through this, but I want you to again highlight the SOAP of SOAP. Insurance company usually prefer progress notes to be in a story form following a SOAP format. The use of abbreviations is discouraged. If abbreviations are used, include a key with every report. Session notes should be typed or written very clearly and easy to read and understand. This is why I prefer typing things, because I have chicken scratch. Tends to get a little interpretive. The initial SOAP documentation includes the name of the client, name of the physician, name of the therapist, date of the service, location, type of visit, initial or the number in the series, and in the header of the document. So when they get it, they have all the information like, oh, this is who it is, this is where it was, this is who did it, this is what number it is. So we have our subjective portion contains the client's experience of the condition, including complaints and symptoms, when and how it started, what makes it better or worse, what has been done about it and the results, and the client's impression and response to the treatment. Objective. This portion contains the therapist's observations of visual and palpatory findings, as well as a result for examinations and tests. Remember, when billing insurance, all objective and subjective findings must directly correspond to the diagnosis on the physician's prescription. Assessment. This portion of the report contains the physician's finding or diagnosis, as well as functional outcomes of the massage session. And then the plan. This portion contains the treatment plan as directed by the physician, including the type, duration, and expected outcome or results. SOAP documentation for follow-up sessions is somewhat briefer. So the SOAP, the S portion contains client's updated current experience of her condition, including reactions or responses to previous massage sessions. So how are they feeling now? The O portion contains the therapist's visual and palpatory findings, as well as results of any examinations or assessments. The A portion reports any functional outcomes the therapist observes or the client reports as a result of the session. And the P portion describes the procedure used and suggested exercises. All right, Let's talk about that 1,500 health insurance claim form. Oh, yeah.
Get the beeping off.
Dave, it's not in here, so Dave popped in, told me. Thank you. Let's highlight here. Insurance companies have adopted a standardized form for billing purposes. The 1,500 form was created by the Healthcare Financing Administration and is now used throughout the insurance industry, eliminating the confusion from different forms from every company. End highlight. The Centers for Medicare and Medicaid Services use identical form for billing Medicaid and Medicare Part B services. The 1,500 insurance form was designed to be read by optical character recognition, OCR software, which is why it's printed with special red ink. The form ideally should be filled out using a typewriter or computer using black ink. Handwritten forms cannot be read by the computer and can result in a delay of payment. If the form is handwritten, use black ink and very legible writing. If using a computer, make sure the printer is aligned properly so that all entries are clearly readable. Use all uppercase, capital letters, and easily read Courier Arial 10 to 12 point font. Do not copy, staple, paperclip, tape, or fold the form. Some office management software companies have developed programs to help prepare the 1,500 health insurance claim form using the client's information from client intake and history documents. So they'll have something that they can populate the information with on the form, so you don't have to worry about it being misaligned or anything. The intake form can be designed so that it contains all the necessary information to transfer the 1,500 health insurance claim form. Codes. The 1,500 form also requires the use of procedural codes that refer to the services provided, CPT codes. Diagnostic codes that refer to the doctor's diagnosis, which are ICD-10 codes, and place of service codes indicating where the service is provided. ICD-10 codes are published by the U.S. Health and Services Healthcare Financing Administration. That's a mouthful. Go ahead and highlight that. And are specifically related to the condition of the client as diagnosed by the physician. ICD-10 is an acronym for International Classification of Disease, 10th revision, clinical modification. The system was first created by the World Health Organization and has been modified in the United States. Let's highlight here. Every health condition has an assigned decimal number that is used on insurance form to aid in the uniform reporting of ailments. A medical diagnosis and corresponding ICD-10 code can be provided only by a doctor. It is preferred that the doctor or physician's office include ICD-10 codes on the prescription. So they know exactly what code they're using when prescribing massage. All right, and your highlight. If a prescription does not have an ICD-10 code or CPT code, the physician's office can be called to supply or verify the codes. Usually the doctor's office is very cooperative about supplying proper codes. Remember, it's outside the massage therapist's scope of practice to diagnose or provide ICD-10 codes. Just because you know what codes should be applied does not mean that you write it in. However, it is the therapist's responsibility to enter the correct ICD-10 code for the client's condition on the 1,500 health insurance claim form. So you have to procure it. If you see a theme of using the same code over and over by maybe a specific doctor, you can't just assume. You have to call and make sure, verify that that is the code that they want to use because they are prescribing the prescription. CPT codes. Current procedural terminology codes were developed by American Medical Association to categorize and quantify medical services accurately. The codes provide a common language and a base for communication among physicians, therapists, patients, and insurance companies. CPT codes also list the allowable fees for each listed procedure. It is necessary to verify the insurance with the insurance adjuster which codes are currently recognized and reimbursed. Workers' compensation claims also require the use of CPT codes. However, worker compensation may update codes covered in their fee schedule only every several years. Therefore, contact the state's workers' compensation office to obtain the most recent fee schedule. CPT codes are arranged according to medical specialty, in which specified levels of medical training or certification are required to use particular codes. Massage therapy falls within the category of physical medicine. A therapist must have proper training for the codes that they bill for, and even to the extent that they could explain the technique and reason for using the code in a court of law. As of the latest revision of this text, the CPT codes most commonly suggested for use by massage therapists, the following. The therapist should always verify with the insurance carrier which codes are considered for reimbursement. So when this book was written, these were the most recent. The book was revised, I believe, 2017 and published in 2018, or maybe 18 and published in 19. I'm not 100% on that, but so they're not that old in this revision. So massage CPT codes, let's go ahead and highlight this box here. 97010 is the application of a modality to one or more areas, for example, hot or cold packs. A 97124, therapeutic procedure, one or more areas, each 15 minutes. Massage includes effleurage, petrissage, and or tapotement, gliding, kneading, compression, percussion. Then we have 97140, manual therapy techniques, e.g. mobilization, manipulation, manual lymphatic drainage, manual traction, one or more regions, each 15 minutes. And we have a note here. Note, this code replaces 97250, deleted in 1999. Use this code for all therapeutic work. See 97124 for standard massage. All right. So now that we've learned those codes, let's read the next section. Codes change often, right? Because of the widening acceptance of massage and other complementary health practices, new codes are being considered to better describe the various therapies. You have to have a code for each type of therapy. So the more codes there are, the more you have to learn, and the more specific each prescription is going to be. Practitioners should stay informed of CPT codes. CPT codes are revised yearly with a new CPT manual published annually. It sounds riveting. Manuals are sold at most major booksellers or can be obtained through the American Medical Association on their website. Rather than purchasing the code books, the therapist can determine the proper codes to use from the physician's office or insurance carrier. Contact each claims adjuster when beginning a new case to verify the codes to use. Insurance might not pay for evaluation done during a preliminary client visit. If the insurance company wants evaluations and will pay for them, ask the adjuster which code to use to cover for this service. Home stretch, guys. Limits on reimbursement. Insurance usually only pays 1 hour of physical medicine per date of service for a maximum of 4 15-minute procedures. Many carriers allow only 2 units or procedures on a specific area of the body. Each CPT procedure delineates a 15-minute increment. Therefore, 4 increments or units constitute 1 hour. When listing the procedures on the 1500 insurance claim form, put 1 unit on each line. It is the therapist's responsibility to know that the codes used are proper and within his scope of practice. The state workers' compensation determines the reimbursement scale for every procedure listed in the CPT codes that is covered by workers' compensation. It is necessary to obtain authorization for every workers' compensation claim. When calling workers' compensation authorization, call the insurance adjuster of the company carrying the policy, not the state workers' compensation office. After authorization is received, the therapist agrees to accept the payment schedule from the workers' compensation insurance and not charge the client anything above what is paid for by the insurance company. So you can't, you have to agree to accept the fee that they set forward. You can't, okay, well, workers' compensation will pay a portion and I'll just bill the client for the different portion. That's not how it works. After authorization, oh, nope, we did that. The therapist can request a claim guide or fee for service manual from the state workers' compensation office that should include which procedures are covered and the fee allowed for each procedure. All right. Placement of service codes. Place service codes on the 1500 health insurance claim form in box 24B. Codes that massage therapists might use are the following. 11 for office. Let's go ahead and highlight all of these. 12 for home, 21 for inpatient hospital, 22 outpatient hospital, 34 hospice, 61 inpatient rehabilitation facility, 62 outpatient rehabilitation facility. Right, so that tells the insurance where it took place. We talked about it a little earlier. In the, when you submit, it has to be listed with the initial form where it took place. This code tells them where. The therapist completes the 1500 health insurance form, including services provided specific to the diagnosed conditions and the individual and total cost of these services. The therapist includes their tax ID number, either social security number or employer identification number, the address where the services were provided, and business or billing address, and then signs and dates the document. The completed 1500 health insurance form with the required supporting attachments is sent to the insurance adjuster. If it is an initial filing, a copy of the prescription, initial assessment, type session progressive notes, and the assignment of benefit forms are included. Insurance company pay only for medical care that is considered medically necessary. The company determines medical necessity according to the documentation, including the physician's referral and prescription, the initial visit history documents, and the initial session progression notes. These documents must be complete and clear. The insurance carrier might require progress notes from each session to be included with subsequent claim submissions. The treatment and documentation must coincide with the physician's prescription and diagnosis of the patient's complaints to be considered by the insurance company for reimbursement. Be prompt when submitting claims. File the first claim as soon as possible after the client's initial visit. It is preferred that no more than 2 to 3 visits be included on a single form. Smaller claims seem to be paid more quickly. As always, retain a copy of everything that is sent to the adjuster. Insurance company response. Insurance companies are supposed to respond to claims within 30 days from when they were submitted. If the therapist does not receive any notifications in 6 weeks, including time for mail and mail delivery, they should contact the adjuster to inquire the status of the claim, document the inquiry. If it is a phone call, document date and time to the minute, the person with whom the therapist spoke, what was said, and the tone in which it was said. The agent might say the claim is under review or say they need more documentation. If denial or reduction of fee is part of the conversation, be sure to document any and all reasons. Be as diplomatic as possible when working with insurance adjusters. Remember, it is better to have them as an ally than an adversary. If diplomacy fails, persistence and assertiveness might be required to move the process. If the insurance company continuously delays action or payment on the claim, the therapist might inform the client and have her or her attorney contact the company. Another avenue of recourse is to contact the state insurance commissioner to file any concerns. If all else fails and the claim is denied or fee is reduced, contact a client, inform her of the decision, and remind her, according to the signed agreement, she is now responsible for the balance due. So if the insurance turns around with a denial of the claim, we had them sign that form 2-3 pages back, maybe 4. Agreement of payment form 27. 20-7 on page 771, right? So in the event that you are denied, you have that form, so you still get paid for services provided. You had to go through a little rigmarole and a denial, but you still have that documentation to say, okay, yes, we tried to do your insurance billing, your claim was denied, you now need to pay for the services, right? And that's that with insurance billing. I will say I never personally got into insurance billing because it did, it requires a lot of legwork. I mean, it's lots of phone calls, lots of documentation. But I have had other therapists that worked with insurance billing, and when you start doing insurance billing, you become more familiar with it. You can provide yourself with some fairly consistent work, especially if you have a doctor that is prescribing and referring to you specifically. But otherwise, it's up to everybody. It's not for everyone. If you are not a very person when it comes to paperwork, I mean, it's a lot of legwork. All right. But is there any questions when it comes to it?
Where would you get that form? That 5 or 11, I don't even know what it's called now. 1504, is that what it's called?
The 1500 form?
Yeah.
I'm assuming it's listed online. I think it says underneath it.
Yeah, it had a like Cengage brain or something.
Yeah, it's access a sample of the form, refer to blah 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 blah. I'm assuming you could either print it from whoever supplies the insurance form. I'm sure it's some government document that you can download.
Oh, okay.
Just like how you can download the form for like a W-2 or whatever to fill out.
Mhm.
Or not a W-2, but your income tax form. You know what I mean?
Yeah.
I don't do a lot of, I never did insurance billing. The only thing I ever did when it came to insurance is I had some clients from Canada and they had prescriptions for insurance, but their insurance coverage is more comprehensive of massage and doesn't have quite as many concise codes. And so I would just provide them with a receipt and they would submit their receipt to insurance. So I didn't have to do anything. All I did was provide the service. They paid me directly and then waited for a reimbursement. That's the only time I ever worked with massage or with insurance. Not to say that it's bad, it just wasn't for me. I'm not a paperwork person. Less paperwork, the better.
Well, I mean, even if you took those, couldn't you say to the client, you're going to have to submit your own paperwork to the insurance company and give them a receipt? Can't you do that still?
Right, but you have to explain that, you know, it might not be, especially in the United States, since you didn't go to maybe an approved provider, it might not be covered. So you have to have them have that caveat. Right, so that's most of the time why you have to get into insurance billing and make sure that you are the specific therapist doing the specific treatment with the right code for the client. Does that make sense?
It just seems like a lot of unnecessary work.
Well, and it's lots of red tape, because I don't know if you've ever dealt with insurance billing before, but it's just how they operate. It's so that people can't scam, but it makes the legitimate people work all that much harder.
Right.
Right. Make sure that you guys are doing your end of chapter review questions. We see 1 through 12 here on page 777. I believe that came through on your email as well. Everybody got the email? Do we have any other questions? Maybe not pertaining to the chapter, but anything else, emails or anything going on? No? Enjoying quarantine?
Ready to go back to school.
Yeah. Yeah, we're ready to have you guys back as soon as it's able,
Yeah.
whenever that is. All right. Well, let's button it up for today, and I will see you guys next, what's today? Monday. I just wake up and come in. I don't know what day it is. All right, guys. Have a good afternoon, okay?
You too.
All right. Thank you. Bye.
Bye.
See you next time.